Welcome back, Malaysia. Okay, so from cooking, we are going into a very serious topic concerning women, and that is breast cancer in younger women. We're literally skewing it down to younger women. We've got the doctor and a survivor in the house, so let's welcome, without much delay, Dr. Harley on Constantine's left, consultant breast and endocrine surgeon, Harley Street Group. And of course, next to Dr. Harley is Farah Idayu, who's a cancer survivor. Hello and hi, good afternoon.
Welcome to the studio.
Thanks for joining us.
Now, doctor, let's begin with our first question for this afternoon. And, you know, we're seeing a lot of breast cancers more in younger women nowadays. And why is this happening?
Well, to be honest, we actually don't have an answer. Traditionally we talk about risk factors, and most of the time the risk factors are things like, you know, having your periods later in life, having your first child at a very late age after 30,
right?
And you know, those who don't have kids at all. Of course, there are other important risk factors like smoking, excessive alcohol consumption. See, these are risk factors that are traditionally thought about in the textbooks. But then again, there are so many patients who are actually getting breast cancers who don't have any of these risk factors.
Right.
And so we don't really have an exact answer as to why it's happening, and more so in the younger women these days. I mean, our concept of it is probably it's multifactorial.
Right.
It's probably, you know, lifestyle choices that we make these days. A lot of women are, you know, working women, stress, working stresses. They don't take care of their health very well. There's no time for exercises. Many of them, you know, busy working.
Yep.
In the city, your stress levels are extremely high. By the time you get home, 8, 9 o'clock at night, you know, that's how things are. And so diet, most of them are eating out all the time. There's no good, healthy, nutritious food. We're eating, you know, food that's cooked out in the stalls, restaurants, day in, day out. And then plus, I personally also think that it's a lot of it is also due to the technology that's surrounding us. We're surrounded by satellites, invisible X-rays, radiation, our phones, our computers, everything is high-tech.
We're just a bit too techno at the moment.
Exactly. So it's probably a combination of effects, you know, combination of things, We're just exposed to it,
You mentioned city. I mean, is there any difference between the risk of women having breast cancer in the city and
rural
areas like in the kampong?
Well, the thing is, we do see a lot of young women having cancers these days, but they are city girls. Most of them are working girls.
I see.
Now, in the kampongs and all that, of course, women do get cancer, but I think they are more the elderly.
Right.
You know, I mean, their lifestyles may be a little different, more, you know, different from what the city folks are actually going through. Whether that has a bearing on why these women are getting breast cancer, I mean, I don't have a definite answer.
Okay.
It's just, you know, hearsay and things that we see as doctors. It may be anecdotal at this point in time, but I think there definitely is some bearing on all this.
And it's come to a point where our lives are literally based on work, stress, work, money, stress, work. I mean, we've just come into that little circle of complete, you know, chaos where we're running to achieve things in life. We're not, you know, we sort of lag behind when it comes to our own personal health and everything. Which brings me to Farah Idayu, actually. Farah, thank you so much for joining us this morning and sharing your story with us. Can we just, if you don't mind us asking, I mean, when did you first find out that you had breast cancer, and you know, what followed?
I was first diagnosed on 28 December last year.
Okay.
Right. At first, to be honest, I'm a gym freak.
You're a gym freak?
Yes.
Wow.
Okay.
I do a healthy lifestyle. I go to gym every day.
Okay.
I run. I take care of my food, my intake. But still, I got cancer. So there are this one day when I went for a biopsy. Then Dr. Harley came and see the result that I have cancer.
Okay.
And I was extremely sad.
When it was diagnosed, what stage was it at?
It was early stage 3.
Stage 3 already? Stage 2. Okay.
Right? And I was sad, but I guess life has to go on. And the reaction when she diagnosed me, when she said with all her scientific
jargons,
terms, and my reaction was I was crying. 1 hour to 45 minutes. Then after that, I went shopping to KLCC, to be honest.
You went to KLCC?
And I went shopping. And I guess I'm a person who, okay, fine, I got cancer, okay, alright. Then what I do later at night after I went shopping, I find out some research, and I realized that there are a lot of cancer survivors out there.
Yes,
Yeah.
yes.
Right? So even though I live a healthy life, I still have cancer, but it's okay. There must be something that God want to give me,
Yeah.
in a way. So I be positive, I stay positive, and I wanna fight it. So alhamdulillah, I'm still here.
If
Well,
you
that's
don't
a
mind
good
us
role, though.
asking, how old are you, Farah?
31 this year.
31.
Yeah.
Okay. And how has the journey been for you since last year? You know, family coming in to help.
I'm getting a very positive vibe from
Good
my
for you.
whole family, from my friends, and from my office mates.
Awesome.
They are very, very supportive.
And you're going through chemo right now.
I'm going through chemo. I just finished my last round 3 chemo last Thursday, and I'm on my 6 days of recovery, and I'm here. And for people out there who are doing chemo, no worries, you can do all your things in the normal way.
Awesome.
Right, right.
I
So you
think,
can live
you
your
know,
life
hats
every
off.
day.
Seriously, Farah, hats off.
That's the spirit.
That's you know, that's the spirit, a fighting spirit. I think that's what we want. Now, right before we get back to our guests, I believe we have a caller online. Yes, Mr. Producer? Yes, Mr. Vincent, you're with us this afternoon.
Yeah,
Hello.
good afternoon.
Hi, good afternoon.
Okay, I just like to talk about this. Nowadays, a lot of young women, they smoking, clubbing, a lot of lifestyle. So, what's the comment?
Okay,
Regarding
that's
this?
the, okay, brilliant. Thank you so much, Mr. Vincent.
Okay,
Thank you for your call and your support as well. He sort of,
Well, I think it's basically echoing what we said earlier.
Yeah.
I mean, poor lifestyle choices. I mean, you're surrounding yourself in an unhealthy environment, smoking, you know, areas where other people are smoking, and you're surrounded by passive smoke.
Yeah.
I mean, not just for breast cancer, any cancer for that
Yes.
matter.
Yeah.
We're actually seeing lung cancers in women more common these days.
Oh, wow.
And this is definitely, you know, a sign that because more and more women are smoking,
Right.
so it's something that, you know, they have to wake up and decide for themselves what's good for them.
well, doctor, it sort of contradicts a lot of things. I mean, Farah said she's been a gym freak. You know, she's been watching her weight, her health, her food. So she's literally the epitome of a perfect example of someone who's living a good life, a healthy life, as compared to some of us out there.
And it still happens.
And it still happens
Exactly.
to Farah.
Yeah.
So how do you strike a balance here?
It's difficult, so that's why I say we don't really have an answer till today. I mean, there are some people out there who have genetic predisposition
There you
if
go.
they are harboring some genetic problems, but in her we wouldn't know because we haven't actually done a check. But she doesn't have a family history for us
Right,
to go back
right.
on. If there was a strong family history, then yes, your risks are going to be higher. And if you are harboring some genetic predisposition, you have a tendency to develop breast cancer at some point in your life.
So it is genetically linked then?
Some of it, not all.
Not
of it.
all.
Yeah, just about 10 to 15%. The rest are sporadic. We just have got no answer.
Right. Okay. Now I know for a fact that some of the women who go in for checkups, you know, they do find lumps. However, those are not, you know, something very serious, and I'm not too sure whether it's benign or what, but apparently it does not lead to cancer. So, can we say safely? Again, correct me if I'm wrong. That certain cysts that are benign are not exactly cancerous. Is that something that you would go by?
Yes, definitely. I mean, breast cysts, simple breast cysts, they actually just fluid-filled spaces in your breast.
Right.
It's not even a solid lump, and they don't change to become breast cancers. So they are hormonal dependent problems that, you know, wax and wane in your life. It gets bigger, smaller with your menstrual cycle. It gets less as you menopause.
Right.
Now, things like that you actually don't need to worry about them. Just a monitoring will do. But if you have things like complex cysts, that's a combination of cyst and solid lesions, those need to at least be biopsied to confirm that they're benign.
Okay.
And lumps, fibroadenomas,
Right.
they are non-cancerous lumps. They're very common in young women. They're all hormone-dependent problems. And they rarely, I would say 99% of the time, they never change to become cancers. But of course, rarely we do get some unfortunate patient who develop cancers in them.
Right.
So because it is breast tissue, it's part of your breast. So
Right.
if it's unfortunately you get a breast cancer there, so it's sort of blame that it's a fibroadenoma possible that has changed to become breast cancer.
Now I have a question. Young women who are married and they find out that they have breast cancer. How has the cases so far that you've seen? Does it affect the marriage?
Well, it does take a toll on many of the marriages. I mean, so here is where the spouse is very important. I think the well-being of a woman really depends very much on the support she gets from a spouse if she's married. Because a lot of times in our society, it's the spouse that dictates terms, in the sense that the type of treatment she gets, if at all she gets any treatment, and you know how supportive he's going to be.
Yeah.
And I think it's very important, so I usually counsel the husbands as much as I can as well, so that for them to understand that this is not a death sentence. So, and it's not going to change your wife. Yes, she's going to go through a little bit of hardship. With your support, she'll get there. And life will go on after that, back to normal. And that's very important for them to understand that. Of course, there are some of early parts of their marriages. Yes, there may be some who can't handle the stress of the treatment, the problems, the emotional roller coaster that the woman goes through. A lot of things does take a toll on many marriages, but I mean, there have been good ones, there have been some who are not so fortunate. You know, it's difficult to actually say.
It all depends on the person, isn't
exactly.
it?
And the
support
family
system.
unit as well around the patient.
The support system itself.
Exactly.
Farah, just coming back to you, talking about support system, who or what has been that inspiration for you, that rock of support that made you, you know, actually come up to our show this morning and literally, you know, go on with life, not sitting down and taking it, but fighting it?
I won't say I have an inspiration, but I say I have an aim of life.
Okay.
Right? I want to get back what I want, but in a healthier way. And I want to give back to people who give me the positive vibe to them.
Fabulous.
Right?
Fantastic.
So I want to be a fighter for myself and for them. And I believe that I'm going to kill this cancer cell inside me with my positivity and with people who are with me now, who are giving me the support.
Has Farah gone through any operation, doctor, for her treatment?
Yes, she had her surgery done and now she's going through chemotherapy.
Okay.
Yeah.
So how has chemo been for you? I mean, because, I mean, let's face it, a lot of people know that chemo, you tend to have side effects on your body itself. For you, how has it been when that started coming in, the onset of that?
I can't lie, it's like, it felt like a morning sickness, double it, I guess. But I'm taking it very easy, I think, because I do a lot of research and I have, there are few of my office mates that have faced their spouses in cancer, they do chemo, then they gave me all these worst case scenarios, so I have readied myself for that. So when it comes to chemo, for me, when it's not that bad, so I felt it's quite easy. And when your hair is starting to fall off, you're getting bored, you're trying out all the new wigs, and I find out that the journey is fun, you know.
It's beautiful seeing the fun side of this.
Yeah, I mean, it's how you look at it.
Yeah, it's not everybody can experience going out in public. Can experience weak, how to feel yourself, and in other way it built up your confidence
and your self-esteem. I mean, seriously, kudos to you, Farah.
Kudos
I mean, you're sitting here and I'm sure you're inspiring a lot of people out there just watching you. You are. It's amazing.
Now, Farah, I have a question for you, and that would be, how many hours do you have to spend in a day for chemo, and how does your workplace treat you? I mean, knowing that you have breast cancer, you know, are they supportive? Does your boss, you know, allow you to perhaps, hey, you know, I need to go out for chemo and
take a break,
or how do they respond to what you're going through?
The process of chemo is, in my case, the regime is 3 weeks once. So I decided to go still on work even on my chemo. So I will be on 1 week off and 2 weeks in work. So when I'm back to work, everybody treat me as a normal person. And I'm happy for that. And if they are hearing it, I'm very happy for that.
I'm sure they're watching right now.
Right?
Fantastic.
You've got a fabulous workforce out there. Yeah, your company is a very good company.
What I was amazed of, they even have this awareness wherein when I walk in, if they are sick, because when you have chemo, your immune system will be down. So they will say to me, Farah, I'm fever, don't come near me. They have that awareness.
That's amazing.
And I really felt that, I felt blessed that I have them. I have a very good, supportive bosses, supportive colleagues. So
that was wonderful.
I think, thank you for them.
There you go. She's saying it on national TV. Thank you. But Farah, I think it's all of us here, and I know the camera guys are back. They're listening to you, and we're all feeling it. The inspiration that you're giving us, that you didn't take anything lying down. You just got up there and said, "I'm going to go shopping, and I'm going to see how I can fight this."
Retail therapy. That's what it's called.
That's amazing. Ladies and gentlemen, all of you out there, 2282-8578-8579. If you want to give a call, give a shout out to Farah. Give words of advice to Farah, or maybe just words of wisdom. Give us a call, all right? Doctor, coming back to you, what is that one advice that you'd give the younger generation or the women out there in the workforce? As you mentioned, massive stress, constant running around, and literally multitasking in a lot of ways. What's the advice you'd like to give out?
I think the only advice I can give to women out there is to realize that you are not exempt from developing breast cancer. Because a lot of them are under the impression that I'm young and this is a disease of the old.
Okay.
So awareness is lacking, that they may have breast cancer. They tend to ignore, lumps and things like that that they get. So, I mean, you've got to be aware. I think that's very important, and take charge of your health.
Hold that thought, because we do have a caller. Apparently, she's got a question for us. Yeah. Hi, good afternoon.
Hi, good afternoon.
Hi, Jane?
This is Jane here from Clare.
Yes, go ahead.
I just would like to ask a question, right? I just asked the doctor.
Please.
A friend of mine, a rather young girl, she was only 29, and she was going for prenatal checkups. Now, during that time, doctor did not tell her that she had any symptoms of breast cancer. But after her delivery, when she went for her postnatal mother and baby checkup, doctor told her that she had breast cancer, diagnosed at 4th stage. Now my question is, why wasn't it detected during the prenatal checkup?
Right.
It was only detected at the postnatal. Wasn't there any symptoms? Wasn't something that doctor could tell that she had breast cancer?
Okay. All right,
and eventually, this poor girl, 29 years old, she actually passed on.
Oh.
She was at a 4th stage. So, this is my question. Why was it not detected during the prenatal and it was only detected at the postnatal? What happened during these 9 months or whatever?
Okay. Thank you, Jane. Thank you very much for your call. Our sympathies go out to you, and of course our condolences to the losing of a friend. Doctor, any words?
Well, I mean, this is a common problem. I've seen quite a few. Now, unfortunately, you see, when you're pregnant and you're going for a prenatal checkup, not everyone goes through breast ultrasounds and things like that as a basic screening. I mean, some of them do. Fortunate for them, things can be detected. So sometimes the thing could have been there, the lump could have been there, it could have been missed. A routine clinical breast check may have missed it when it's very small. Now, throughout the course of pregnancy, your hormones are surging. These cancers can actually be aggravated. So some of them grow very quickly during the pregnancy, and they are detected halfway through. Unfortunately for this lady, that it was not picked up. So I'm also a bit amazed that a stage 4 cancer, and the doctor didn't pick it up. Yes, because it should have been picked up at some point.
That's right.
The problem sometimes is that women's breast starts to swell up during the pregnancy. As they go towards term, milk production starts taking place. The breast gets swollen, and many of them are mistakenly told that, oh, it's just part of your breast
the development of your changes,
throughout
hormonal
pregnancy.
changes. Right.
So when they complain that I feel my breast is lumpy or something, it's ignored very often. Unfortunately, it does happen sometimes. Sometimes it's picked up, but often too late.
So then, would you recommend for the women to actually go through a breast examination, even though they're having?
Well, I think every woman needs to have a breast examination by the time she's 20. You should have ultrasounds at least once a year when you're 25 and above. Because it's such a common problem.
And mammograms, for instance. How often should that be
Well, mammograms are started when you're about 40 and above, so not before that. And we do usually advise mammograms at least once a year, because there's an increased rate of cancers in that age group nowadays. Between 40 to 50, it's a peak incidence of cancer. So it's not part of routine screening, but we do advise patients that this is a good thing to do at least once a year. A mammogram, a clinical check with your doctor, and an ultrasound of the breast. I think it's a very good investment.
All right. Before we let you go for the afternoon, Doctor and Farah, Farah, your words of advice to our viewers out there who are watching you, inspired by you, definitely. I mean, I know Constantine and I are inspired by you.
Indeed.
For people out there who has breast cancer, please be strong, be strong, be positive, be a fighter always. Always think that you can kill the cancer with your positivity vibes. And for people who are having a friend who have cancer, do support them.
Give them
do
the
support them. And if you give them support, so you will see something like me. Seriously.
Amazing.
Amazing.
Amazing. That deserves a round of applause from everyone. It's amazing. Thank you, Farah. Thank you so much for joining us this afternoon. It is wonderful that you've been here and you shared your story with us. And trust me, I mean, I'm close to tears right now. There are people out there who'll probably look at you and say, yes, if Farah can do it, I can do it. I have to ask you this. Are you back to the gym?
Currently, my oncologist only gave me a brisk walk, so I would just give a brisk walk then.
Okay, well, brisk walk is just good.
Yes.
And you look fantastic, by the way.
Thank you so
Whatever said and done, you still look fantastic.
All right.
Doctor, thank you so much for this afternoon.
welcome.
Thank you for
It's
dropping in
been
the
a
studio.
pleasure. Farah, it's been a pleasure. And thank you so much for sharing with us information on breast cancer in younger women. And as the doctor mentioned, it's good for you to go and do your ultrasounds once a year. For women out there, I mean, we're all busy women. We all have our responsibilities. We're all running around like crazy. I know how it is. Some people start as early as 4 in the morning. Just remember, do your checkups, do your regular checkups.
That
Never
would be
say
your
no.
responsibility, right?
Yes,
Yeah.
that's right. Stay with us, Malaysia. We've got more stories coming your way. We are going to be talking about still women and a lot more hot happening segments coming your way. So, Constantine and Annie in the studios. We'll see you in a bit.